So you go into the ER and a doctor says they're going to manage your condition.
Right.
But then you go to the dentist and they tell you they're going to extract a tooth. I mean, one of those sounds like a corporate HR meeting, and the other, well, it sounds like a literal construction site.
Yeah, it really does. It's a completely different vibe.
Exactly. So today we're doing a deep dive into the secret action language of healthcare. We are decoding these essential clinical verbs that get thrown around in hospitals, dental offices, and pharmacies.
Because, by understanding these specific action words, you really demystify the medical jargon. It's super empowering.
Yeah, and imagine it gives you a lot of agency.
Absolutely. You'll know exactly what professionals are doing with your body, your data, and your prescriptions. It gives you a huge amount of control over your own care.
Okay, so let's unpack this. Let's start with the very first thing that happens when you walk into any clinic, the detective work.
The assessment phase, right?
Right. We see all these verbs like assess symptoms, detect abnormalities, or rule out things like malignancies, which, by the way, is just the medical term for cancerous growths.
Yeah, rule out is a huge one.
But I've got to be honest, when a nurse says they are going to monitor my vital signs, it sounds, I don't know, it sounds incredibly passive, like they're just going to stare at a screen while I sit in a bed. It doesn't really sound like active detective work.
I get that. It
Yeah.
definitely looks passive from the hospital bed. But monitor is actually a highly active, continuous investigation.
Really? How so?
Well, they aren't just casually watching a screen. They are actively hunting for tiny deviations from a standard baseline. I mean, you cannot safely move to the repairing phase until you've used those verbs like assess and rule out to build like a complete map of your current state.
Oh, I see. So establishing that baseline basically dictates every physical intervention that comes next.
Exactly. It's the foundation for everything.
Right, because once you know what's wrong, that data triggers the actual action. But, and this is what's wild to me, depending on what chair you're sitting in, the physical reality of those actions looks completely different.
Oh, for sure. The terminology totally shifts.
Yeah, like look at the hospital verbs. Doctors resuscitate patients or they stabilize blood pressure. It's very broad. But then you look at the dentist, they extract teeth, they drill decay, they irrigate sockets.
Which is basically power washing a wound to prevent infection, by the way.
Wow, power washing. And they
Brilliant.
scale, right? Like scraping off hardened plaque. It is a massive contrast.
It really is. If we connect this to the bigger picture, the dental verbs reflect structural mechanics.
Yeah, it's like microsurgery, treating the human body like architecture.
That's a perfect way to look at it. They literally treat the mouth as architecture, drilling, scaling, and extracting. But hospital verbs, on the other hand, treat the body as an ecosystem.
Right, so it's less about fixing a pipe and more about the whole system.
Exactly. When a doctor works to stabilize blood pressure or, recover you from anesthesia, they are managing interconnected systemic networks. They aren't just fixing one isolated beam.
But the ecosystem doesn't just stop at the hospital doors, right?
Yeah.
Eventually, you usually end up at the pharmacy. So we're moving from physical procedures to chemical management.
Yep, the chemistry set.
And looking at the sources here, pharmacists do way more than just dispense pills. They compound or custom mix creams, and they actively watch out for how drugs might trigger asthma or interact with food.
Right. What's fascinating here is that the pharmacy acts as the ultimate safeguard for everything we just talked about.
I picture them as like air traffic controllers, but for your internal chemistry.
That is a great analogy.
Because they aren't just handing you a bottle, they're tracking the flight paths of all these different chemicals. They verify everything because if, drug A and drug B land in your liver at the exact same time, you get a catastrophic chemical collision.
And that's precisely why their core verbs revolve around validation and communication. They verify the prescription, and they counsel you on how to take it.
So they're the safety net.
Exactly. The mechanism here is very direct. The pharmacist's action of verifying and checking for interactions directly prevents the hospital's action of stabilizing from just completely failing.
Oh, wow. So they ensure that introducing new chemical varietals doesn't just undo all the physical repairs that were just done.
Precisely. They keep the whole system from crashing.
So the takeaway here is incredibly practical. Next time you are receiving care, Listen closely to the verbs being used around you.
Yeah, tune into the vocabulary.
Are they trying to detect? Are they trying to stabilize? Or are they checking to see how things interact? Because recognizing those words tells you exactly what phase of the healthcare machine you're currently in.
It translates an invisible, overwhelming process into something you can actually track.
It really does. It empowers you to ask much better questions about what's happening to your own body. But it also leaves us with one final thing to think about.
What's that?
Well, we've seen how physical action and medication verbs completely dictate your treatment. But what happens to a patient's outcome when critical communication verbs like advise, explain, or warn are completely skipped over in a rushed, overcrowded clinic?